Welcome to Storytelling with Lindsay Bednar. Hi,
How are you?
I'm doing well. How are you?
Good, you look great.
Thanks, you too. I
Thank you.
feel great, and I can't wait to talk all about how you are helping me to feel great today.
So exciting.
I know. And thank you for the rescheduling. So the last time we were supposed to be scheduled, all kinds of uh, work going on in our basement, a bit of a shit show. So thank you for being patient and for coming back to hang out.
And thank you for also rescheduling my reschedule.
That's right. That's right. I'm so excited to just share. I feel like every other conversation I have with a woman friend around my age lately has to do with, oh my gosh, things are changing and I'm feeling, I'm getting, just talking to a neighbor across the street who's getting hot flashes. No, I was shopping the other day and I got this like thick flannel and this woman was like, oh, I wish I could wear that, but I get like terrible hot flashes. It's like, oh yeah. And so she told me about some over-the-counter medication she's taking for hot flashes. And I wanted to just be like, oh, no, but there's only so much time in the day. And so hopefully this episode will find her. But um, yeah, I mean, this is a conversation I have with women all the time, how we're going through changes. And I think it's always so interesting to me how anybody gets into kind of changing careers, because there's always like that flicker of something. And so I would love for you to start with just talking about where you were in your previous career and what happened to transition you into what you're doing now.
Awesome. I've had the privilege of working in both the United States and Canada, being born and raised in Montreal. Um, and the majority of my work has been in clinical practice, outpatient primary care, internal medicine, but I've also worked in areas of clinical research and I've been in roles of leadership before. Um, but I would say there wasn't one particular event that occurred throughout my career and my personal life experience that led me to diving into the world of really functional medicine, preventive medicine, and hormone replacement therapy. It was more of a series of events. I had become increasingly frustrated with what I was seeing in primary care, where we would only have, an allotted amount of time to see each patient. The majority of my visits were spent more on prescribing a new medication to treat their symptom rather than actually looking at the root cause of what brought them here in the first place,
Right. And
right?
can I pause you for a sec? Because
Hmm.
I don't really know like who sets the standard of how long you have with each patient. Um, Obviously, it sounds like that's not up to the doctor. So, like, what kinds of requirements do they say? Like, you get this long for a checkup, or what does that look like?
Yeah, so typically it's all run by insurance and compensation.
Okay.
And meaning that the more acutely ill a patient is, the system is going to be reimbursed more. That's the little dirty secret of medicine, in a sense.
Hmm.
So it's not, the system isn't set up to keep patients healthy, in a sense.
Right.
Um, so it's this constant revolving door of, patients coming in and the organization that you work for. Now, I worked for a wonderful hospital, university affiliated system. I loved my team. I loved my colleagues, but I was frustrated with how it was set up.
Yeah,
I
the
would
plan.
have 20, 30 minutes. I mean, 30 minutes really is a luxury in primary care. Now I'm hearing from colleagues that it's more like 15 or 20 minutes a visit. Um, you can't even scratch the surface with a patient.
My gosh.
So that was really the impetus of me starting my wheels of thinking, there's got to be another way
Yeah.
um, to heal patients. So, and this is way back when I started, 12 years now I've been practicing medicine. So I started diving in the world, like I said, in functional medicine, and my practice has always been one more of a holistic approach, if you will.
Mhm.
Um, I believe that it's more to do with the nutrition, what your daily lifestyle is, what is your sleep like, what are you doing for movement and exercise? And then the more I kind of dived into this entire world, the more I kept realizing that hormones were at its foundation.
Mm. Mhm.
And none of this is really being taught in school, in NP school and medical school.
There is, I mean, is it even part of the conversation? Because from what I see online, it seems like there's these jokes about how like nobody cares about women's hormones because there's it's just not a part of the regular conversation, and nor is it a part of any kind of schooling.
So I think it we have to roll back to, and it was before my time of prescribing and practicing. So the World Health Initiative study, are you familiar with that
I,
study?
I am, but please, yes, go into that
Yeah.
for our listeners.
So the WHI study really, till this day, ruined hormone therapy, essentially for women. Um, it was the largest randomized control trial that was done. The results were published in 2003. Prior to 2003, all observational studies showed when women were taking HRT, when I say HRT, hormone replacement therapy, estradiol, progesterone, test, or give or take testosterone at that time,
Yeah.
they showed a reduction in dementia, a reduction in cardiovascular events, a reduction in breast cancers. So then this trial came out. It enrolled 30,000 women, and there was two arms of the study. One arm of the study looked at estrogen and progestin, both of which, by the way, were synthetic forms of, and we are no longer prescribing these, or we shouldn't be. And
Mhm.
the other arm was women who were prescribed just estrogen, conjugated equine estrogen. And I'll add that the conjugated equine estrogen is derived from pregnant mare's urine. So pregnant horse's urine. That's what we were prescribing to women.
Okay.
And the progestin is medroxyprogesterone, which is a synthetic form of what we produce naturally. And 17,000 women were enrolled in the estrogen progesterone arm, and about 10,000 were enrolled in the estrogen alone. And the ones that were enrolled in the estrogen alone, the women had no uterus. Well, the first thing to note about the study was the average age of the woman was 63. And we know that the average age of menopause is around 51, 52 years of age. So they were already 10 years out.
Why? Well, okay, wait. That's like that makes absolutely no sense to me.
Wait till you hear this. So the age range of enrollment was between 50 to 79. A prior cardiovascular event, if it was recent, was excluded, but you could have had a cardiovascular event and been included in the study. When the results, the primary outcome of the study was a reduction in cardiovascular events, so stroke and heart attack. The primary safety outcome of the study was the incidence of breast cancer. Okay.
Hmm.
The study was supposed to go on for about 9 years, and it was stopped at year just under 6 because they noted there was a 25% increase of breast cancer in the estrogen and progestin arm of the study.
Okay.
So the medical media went wild, and
Sure.
all women, all they heard, and all at the time physicians, providers heard was rip all your patients off of hormone therapy because they cause breast cancer. Now, at first glance, right,
Hmm.
25% increase, I would also not want to take hormones.
Right.
But when you actually look at the data, so when we report in research a risk, there's a difference between a relative risk and an absolute risk. And I'm going to explain this. So in absolute, or excuse me, a relative risk, okay, is what they reported, and it's typically reported in a percentile, and it compares two groups, right? So the patients who had no hormone replacement therapy, and then the patients in the group who had the progestin and the estrogen. So between those two groups, the 17,000 women, it showed a 25% increased risk, right?
Hmm.
But the absolute risk, meaning what is the probability of a woman, average age of 63, developing breast cancer who takes hormone therapy, again, in the progestin and estrogen group, was an absolute risk of 1 case per thousand, which is equivalent to 0.1%.
Wow.
So in that arm of the study, there was a difference of 1 case per thousand. In the treatment group, there was 5 cases per thousand that developed breast cancer. And in the placebo group, there were 4 cases in 1,000. So the absolute difference, right, is one.
Mm. Wow.
So that is where, and the crazy thing is it wasn't even the estrogen alone arm of the study,
Right.
right? It was, if anyone wants to blame something, you would blame the progestin.
Yeah. Right.
Because in actuality, the other arm of the study showed that long-term use of estrogen alone actually reduces your risk of breast cancer.
And the progestin was synthetic. Correct.
Progestin was synthetic. So it's called, and this is the part where, the lay person, as well as my colleagues, some of my colleagues who haven't been trained in BHR2 don't understand, is that when you read medroxyprogesterone, that is synthetic. It's not micronized progesterone, which your ovaries produce naturally. And the name of it is progestins.
Mm.
And that's actually what's in the birth control pill.
Wow. Okay. So did they ever backtrack on this study publicly? I mean, obviously, once that information gets out, it's hard to put the genie
I,
back in the bottle, and it's the stigma's out there. I know the stigma's out there because I've had several conversations with people that I'm being searchy, and they're like, "Oh, aren't you worried about breast cancer?" I'm like, "Oh, well." So I know that that stigma's there, but what did they do about it publicly? Anyone?
so they retracted the data. That's number one. But I mean, it's too far gone. I
Yeah.
mean, think about it. This is going back 23 years now, and we're still talking about it. And on top of it, we still, I hit this wall every single day. I mean, you know that as
Mhm.
my patient,
Mhm.
that and you allowed me to
Oh yeah,
say
yeah.
that, right? I just
I'm gonna
for
talk
HIPAA
about all
purposes
kinds.
here.
Yes.
Yeah.
Yes.
Um, you know, the majority of what I do every day is educate my patients to empower them to
Mhm.
be their own best health advocate,
Mhm. Yeah.
because no one else is going to do it for you. And your providers, unless they've been trained, they're sure not.
Well, are they even allowed at your primary care? Are they even allowed to go there with hormones? So what does that landscape look like now?
Yes. So their hands are a little bit tied in the sense that typically when you work for an organization, they would prefer you to prescribe synthetic forms of medication, i.e. not use compounding pharmacies. But I do know of, different OBGYNs that, for example, testosterone, the hormone testosterone, it's till to this day, it's still not FDA approved in the United States for use in women.
Oh,
So there's no
FDA
pharmaceutical.
does that does nothing for me. But for a lot of
Yeah.
people, that's like the
So
label.
so some OBGYNs who are trained in hormones that and comfortable prescribing, they will prescribe. I have a girlfriend, she prescribes through compounding pharmacy. Um,
Okay.
but no, I mean, and you know, it's yeah, I don't want to sound like I'm honing down on all the providers. It's not that at all. If you were to ask me a few years back, how estradiol, how progesterone, how thyroid
Mm,
impacts all your cellular functions in your body, I would be able to answer just the basics, but I wouldn't have
right.
a good understanding. I had to get additional training.
Sure. I want you to talk a little bit about the synthetic versus compounding and what are the difference between the two, just to like really make that articulate that, because I think that's something that I've been new to in the last few years. And then once you delineate between the two, why do providers or uh, why would primary care lean towards synthetic over compounding?
So so for the first to answer the first question, the difference between a synthetic form of a hormone and a bioidentical hormone has to do with its chemical structure. That is it. So
Okay.
the chemical structure is different, and because it is different, it's the metabolites of it that could lead to the unwanted side effects that we see. So
Okay.
I'll
When I hear those words, I think synthetic is fake and compounding is like real and holistic. That's what I think.
So compounding has to do with it still has to do with a pharmacy that is the facility is FDA approved, but the actual product can never be FDA approved because it is bioidentical. It's what our ovaries, and I'm speaking now for women's hormones, it's what our ovaries naturally produce on its own. Um, Synthetic is developed by pharmaceutical companies, and it has just an ever so slightly different, well, depending on the hormone, a different structure. And that is the difference. And I mean, I believe that we're not taught, I wasn't taught about compounding pharmacies. Are you kidding
Right.
me? In school, it's really led by pharmaceutical companies of what you're being taught.
Mm,
Um, so I know a lot about statin therapy.
right. Right. Well, I mean, other than my very insidious opinion as to why they would lean towards synthetic, is there, which is that it comes from the very companies that continue to get richer and richer. Are there other reasons why I say the FDA wouldn't approve a compounding hormone or
I would say that and this comes from the words of my wonderful trainer, Dr. Neil Rousier, it has to do with politics and economics.
mm,
They'll never be able to patent a naturally occurring hormone.
yeah,
So
yeah, that's
it's
what
not profitable. So instead, some choose to prescribe a synthetic version of.
mm, ugh.
So I'll give you an example. Just yesterday, I had a patient on her initial consultation, and she was experiencing symptoms of what she thought were menopausal symptoms. Now she's in her late 40s, and I have no blood work on her, but I could almost bet that she's not menopausal and it's perimenopause, mimicking menopause. But nonetheless, she went to her OBGYN who prescribed the combi patch. So now the combi patch has estrogen and a progestin norethindrone in it. So, I not only had to tell her that, you know, on that initial consultation, as you know, I just really listen. I listen to my patients, see where they're at, and I really hesitate to provide any direction guidance because I don't know the whole story yet. But in this situation, she asked me if, what my thoughts were of the combi patch. And I said, well, to back it up, I don't even think you're in menopause yet. You're still cycling. You had a period in the last, I can't remember, 6 months.
Mm.
Although your symptoms are mimicking menopause, you shouldn't be on any added estrogen because your ovaries are still producing it.
Yeah.
So
Oh, wow. So when she went to her doctor, they didn't do any kind of testing, labs, blood draw, anything?
none.
Yeah, that's like that makes no sense to me, and it feels like that's just a system we're fighting against within our medical care, and we have so many great providers that are hitting their head against the wall, which is what you were doing before you left, because you're having to make decisions based on such little information. Um, and I can't, yeah, I just can't imagine how that would feel to be in that position. And it just seems like shooting from the hip.
Right. And, just we kind of got off tangential here, but coming back to the original question was, what kind of led you? So
Yeah.
as you can see, it's a series of events, right? To opening and starting Renewed Health. So definitely, more time with my patients that I wasn't afforded in a conventional, setting, medical setting. Um, then my whole unraveling of, a part of me almost felt lied to, if that makes sense, all of these years after uncovering like opening Pandora's box and being like, what? Hormones can actually treat anxiety,
Yeah.
can help with insomnia, can improve your energy levels. A natural hormone? No way. No way. I was just completely mind blown. Um, and then and then there was the personal side of it too. So I have 3 boys and all under 8. Um,
Busy.
and crazy, like crazy. They're into hockey. I
Yeah.
coach soccer. Anyway, I started like when I turned 40, things started changing and I was like, what is going on? I started to get night sweats. That was the first thing. After my second child, I started to get these night sweats and I couldn't understand. I was like, what is going on with me? And then just trouble sleeping. And I think really what drove it all was my periods were just out of control in terms of my mood. I was always someone that was kind of even keel, and then I just turned into this raging lunatic, and I couldn't understand what what was happening. Um, so I think
Age was
once you
this for you
go,
when that started? What age? Like,
probably around 37, 38.
uh,
Yeah. And I think and you have 2 children yourself, and I think, the more kids you have, your periods change. And yeah, it was wild. So that was from a personal standpoint where then, I was just so intrigued with our system. And
yeah.
that's what that's what led to it.
So you're in a position at the time, you were working for a hospital. How do you make a shift? Because I think not just for people that are listening that are going to be very curious about hormone replacement therapy, but there's also people who are in your shoes, um, who are trying to figure out how they can serve in the way that they're serve people in what they have worked so hard to get their education, but potentially do it in a different way. So what did that transition look like for you?
That's a great question. And I ask myself this if I wouldn't have taken the leap if I didn't move out of Minnesota.
Mhm.
Um, so I, as you know, my clinic, my brick and mortar clinic is here in Rhode Island. But of course I treat patients in Minnesota. Um, and like I said, I loved what I did. I love my team. And I think that for providers are who can relate to my story, that they want more from their clinical practice, I think they just need to jump. First, before they jump, they need to find their niche, of course. But I can share with you. So I was trained through the Academy of Preventive and Integrative Medicine. It's called WorldLink. And we are now thousands of providers across North America and Europe who have left conventional medicine. And I'm telling you, I'm talking about there are oncologists, endocrinologists,
Mhm.
you name the specialty in medicine, and they've opted to leave their practices to practice solely with preventive medicine and hormone health.
Wow.
It's incredible. So there are many organizations where, of course, you can be trained through. I'm biased. I think that WorldLink is the best, and the reason why I say that is because it has to do with a direct review of the medical literature.
Mm,
So how I practice is evidence-based, unlike what many providers out there think about hormones.
yeah. Wow.
The data is there. It's clear. It's that you have to go actually and look at it.
Right, right.
That's the problem.
Yeah. And then and it's just that, once it gets a stigma, I mean that it's just so hard to erase. I mean, the amount of people that I can see like a visceral reaction when I've said like, oh, I'm doing HRT, and it's like, ooh, like, okay,
You mentioned visceral reaction, and that's such a strong word. And I've had patients use that word when their providers have when they tell their provider what they're doing. And
Mm,
that makes me so sad.
mhm. Yeah, I know. And it's
But also it's a learning opportunity, right?
right, right. And I mean, I think I've experienced that, in so many things in the last 4 years. Like when I refused to get the the COVID vaccination, it was like there were some visceral reactions in my circle. So I'm kind of used to that by now, so it's whatever. Um, yeah, there's I mean, there's so many things I want you to speak to with this because I know one of the conversations we've had, so many women have experienced postpartum, and I know many who have gone on a SSRI, some sort of anti-anxiety medication after kids because, they just can't get rid of their anxiety. Can you speak to what happens with females after they give birth and what happens to our hormones and what you've seen with patients in that as well?
Yes, such a great question. So I actually just had a consultation with a woman in her late 20s who just had her third child, and she's had experienced postpartum with after every child. And for this one, she is really struggling. So the first thing I explain to women is that, and just let me back up 1 second here. And, right off the bat, I asked my women, how was your pregnancy, describe it. Did you have any complications? And she's like, I just loved being pregnant,
Mm,
right? So our hormones are at an all-time high during pregnancy, especially progesterone.
mm,
Progesterone is the happy hormone. Progesterone upregulates the GABA receptor in our brain to help us with improving our anxiety, our mood. It's the calming hormone. It helps with our sleep. Guess what happens as soon as we deliver that baby?
It dips.
It plummets.
Mm,
It plummets. And then we wonder why, women they're obviously sleep deprived, right? When you have a child, but wondering why you have these baby blues, as they call them, or their moods are it's we're lacking progesterone.
wow.
So one of the treatments is to help for women who are experiencing that is to prescribe micronized progesterone, bioidentical progesterone. And I mean, you could attest to that it works beautifully helps you sleep. It helps regulate your moods during your cycles. Um,
I
it's an,
sorry, go ahead.
so no, I was just going to say it's a natural diuretic. So
Mm,
we feel less puffy, when we feel inflamed and puffy around our periods.
yeah.
Um,
Wow. Okay, I just have to write something down because I have
mhm.
to come back to this. So I've never heard of this conversation. Like I've never heard of a woman getting her progesterone levels tested after giving birth. Like that's never been a conversation I've had with anybody. So until you and I talked about that, I don't know, during one of our consultations, I I just couldn't believe that that's like, okay, if a woman's progesterone, if that's what keeps us like happy, we can sleep well, like has so many benefits. And if it plummets after we give birth, how is that not a conversation when women go to the doctor and are like, I'm feeling depressed. I can't even connect with my kids. All these signs of postpartum. How is that not part of the conversation?
No, a part of the conversation is here, let's start you on an SSRI for depression.
Mm,
Let's start you off on sertraline. Now, I also don't want to come across here, Lindsay, as, I'm against all pharmaceuticals because I think there's a time and a place for them.
yep.
Absolutely. But can we just stop for a moment and look under the hood and say, wait a second, is there a more natural approach that we can take with these patients?
Yeah. And I also want to say it's ridiculous but I do this too, that we need to make a disclaimer just
I
because,
know.
just because we are questioning the processes that have been in place for so long. It's
Right.
like, yeah, it doesn't mean I hate all pharmaceuticals. Like,
Right. Like, no haters here. Like, I prescribe pharmaceuticals
yeah,
in my
right,
practice, but I definitely have a different perspective now. How about that?
right. We should be allowed to ask questions. And like, yeah, there's been such a suppression of just asking questions in so many different facets in our society, and I'm so tired of it. And so I love to have these conversations with people because these are the types of things we need to be talking about, asking about. Um, yeah, okay, so I'm assuming that that was never part of your schooling initially, but
Nothing. No, zero. Training, zero. No, this is all, I would say, I mean, it's hard to equate, but because of my background in primary care internal medicine, certainly is the foundation, and uh, it allows me to practice the way I do, right? But I can certainly tell you that my day-to-day treatments, none of it was taught in school. None.
do you think most doctors that meet with women, do you think they're even aware of the progesterone plummet?
I would say no, but I don't. I I would say no.
Wow. Okay. Well, that's pretty big.
Yeah.
Okay. So much. Okay. And then we've only focused on women so far because I know you work with men as well. So
Of course, yeah.
we'll get to that. But since we're on the topic of women, I have to tell you, I just got my period today. I had no indication it was coming this time. Like that, I don't think has ever happened. I mean, we've been working together for a while. There's probably been some times where I was like, oh, but oh, if I didn't have an Aura ring, which tells me when my temperature is elevated when I'm sleeping, that's a surefire sign. So I did have that a few days ago, and I was like, huh, I don't think I'm coming down with anything. I feel good. But I literally didn't even think maybe my period's coming because I didn't have any of the weird cravings. I didn't like Gary wasn't annoying me with just like little things. Like, you want to pick fights when you're PMSing. Um, Wild. Like, what a treat to just be like, oh, I guess I just sailed through PMS and didn't know I had anything.
And, obviously when women, and I mentioned that to you too, when I first started working with you, you come to me for a reason. You have symptoms, and of course I want to treat your symptoms as naturally as we can. But what we don't talk, what I'm most interested in is, as well as treating your symptoms, is how it will help reduce chronic conditions long term that
Yeah.
you are on these hormones. Now, you're not in menopause yet, so we're optimizing yours as opposed to replacing them.
Yeah.
But let's talk about how micronized progesterone, right, protects our brain, protects our breasts,
Hmm.
protects our bones, our endometrial lining.
Yeah. Can we just go into like my readings and things that when I came to you, how low and off I was on things? Like
Sure.
I'm totally fine with sharing. Like
Okay.
I don't care.
I now you're testing me. I don't know if I remember exactly.
Yeah. Well,
Um,
first I'll go back and
I
say,
can bring your truth. Yeah.
yeah, go for it.
Yeah.
You can totally do that. And I was So I was the symptoms I was having when I came to was like the 3 o'clock crash. I was having my sleep was kind of disrupted. My skin was not great. I felt like my libido had dipped down. Um, oh, and then I definitely felt like it was harder. I had to work way harder at like dropping a few pounds of even if it were water weight or anything else. Like
Hmm.
it was just normally it's like, okay, I need to clean things up a bit. I know how to do that. I can do that and get rid of the weight. But it was like no matter I was trying all these things that had worked in the past, and it was like this stubborn weight that it wouldn't move. And I just felt, yeah, I felt like not myself is, probably the best way to say it. Um, so I came to you and we took my blood test and I did not think it was going to be that off, honestly, because I'm just like a naturally happy person, and even if I don't feel good or whatever, I just roll with it. Like it's all right. You know, um, but yeah, I had a lot of room for improvement.
Right. And I also believe that you had some breast tenderness going into your periods. That was a very big
Yeah.
symptom. You probably maybe don't even remember that.
No, I
Um,
know. I have like the fibroids, and I remember when
right.
I got my first mammogram early because I just discovered a lump and was freaking out about it. And they were like, "Oh, very you have a lot of fibroids in your breast tissue." And so, um, yeah, that was something I remember when we had a follow-up appointment and you asked me about them, and I was like, "Oh my God." And I'm like feeling like they're gone. Like I didn't even think about that. Like totally
Right.
gone.
Yeah, it's remarkable. I still get so excited when I have that initial, typically we have our treatment visit and then we have a follow-up 6 weeks later to make sure everything is going well. And then thereafter. But at that 6 week follow-up, it still excites me when um, you know, my patients are, their symptoms they're improving, some even resolved at that point, but mostly improving. And And it's from hormone optimization. And who knew?
Right. Right. Yeah. I mean, my I know my testosterone was very low.
Yep.
Um, Progesterone, I mean, I don't remember those levels, but I remember specifically testosterone and my thyroid.
Thyroid, yeah. So in conventional medicine, we treat what's called hypothyroidism, which is the medical diagnosis of a low functioning thyroid, um, when there's one marker that shows an elevation called thyroid stimulating hormone. But in functional medicine and in BHRT, we know that it's not the TSH that is responsible for the cellular activity, it's the hormone itself, which is the T3 and the T4.
Mm.
So when I optimize patients' thyroid function who come to me with symptoms of low functioning thyroid, which would look like fatigue, inability to lose weight, cold hands and feet,
That's always. I feel like
thinning hair.
that's,
Um, Once we optimize your thyroid function, those symptoms improve.
Mhm.
And I think that's one of the real differences between conventional medicine and functional medicine, where we listen to you, we treat your symptoms, and of course we use lab work as a range. But
Right.
let's get you into a functional range. Let's not treat you. Everyone isn't the same. Medicine is so siloed. You have this, you go to this specialist, you have this symptom. If we just took a step back and
Mhm.
approached it from a more holistic standpoint, and we
Mm.
started listening to patients, acknowledging their symptoms, we would be better off.
Yeah. I mean, our systems are so interconnected. I mean, just even look at like reflexology, which I know very little about, but that you can massage a part of your hand and it's going to get rid of a headache or it's wild how connected every little piece of our body is. And yet when we go to our primary care, we are looking at one sole piece of the body like we're chopped up into little pieces, which makes absolutely no sense.
No.
Yeah, I mean, since I've started, I mean, really everything has improved. My energy, I would wear like slipper socks to bed every single night because my feet were so freezing. Now, my feet get cold on occasion, but I don't, and my hands were always cold. I don't have that anymore. Actually, they're pretty warm right now. Um, and I feel like it had been like that for a while, and my thyroid was probably just off and I didn't know it. And I was fighting so hard against it to like, oh gosh, I'm eating really clean, I'm doing all my workouts and it was just stubborn. And so yeah, now I know if I go on vacation or something, I know I can course correct with like just cleaning up my diet and whatever, and I can get back to me very quickly, where that wasn't the case for several years.
Right. The thyroid is a workhorse. It's responsible for our metabolism, for our temperature regulation, for our sexual health, for our moods, our cognitive function. There's
Mm,
essentially receptors on every cell in our body, aside, of course, for some red blood cells and white blood cells, but every other cell in our body.
well,
And we currently just treat if this TSH is above the normal range. We don't even look at the cellular activity going on,
why is that?
because that's how we were taught, and that's the standard of care.
Oh, yes, okay.
That's the standard of care.
Hmm, hmm,
Now we look at all other hormones at the level, right? We test your estradiol level, we test your progesterone, But for thyroid, we don't look at T3 and T4 unless the thyroid stimulating hormone, the TSH, is elevated.
Interesting. And then there's also like, which seemed to me to be arbitrary levels of what they consider to be safe. And I don't know, you can speak to how those were set, but I know enough from my sister as to like the FDA has deemed, this amount of vitamin D is what should be the goal for everybody. That's 100% of your daily value. She's like, and all of those are junk basically. Especially, because now the things that because of our soil and we're just not getting the supplements that we used to. So I anticipate it's very much the same in the medical field that if they're saying this level of thyroid would put you in a too high range, just like she sees with her clients, where if this level of cholesterol is too high range, a primary doctor would think that would be dangerous, whereas she's like, no, that's actually not. And probably same for you, right?
Exactly. So the ranges that we're using, I'm optimizing your thyroid function not to a dangerous level to achieve symptom improvement
Mm-hmm. Mm-hmm.
and to a patient who is, if I plugged your age in, not as 40 something years old, to a younger age bracket, the range would be more broad, right?
Yeah.
So as we age, typically our thyroid function declines and then our symptoms start to appear. And whether or not you go into full-blown overt diagnostic hypothyroidism or not, you can still be experiencing those symptoms
Mm-hmm.
like yourself.
Mm-hmm. Yeah.
With regards to vitamin D, I mean, that's a perfect example. Vitamin D is not even covered on a typical wellness exam checked by medical insurances. Why? Vitamin D is critical for colorectal cancer reduction, for bone health, for your mood, for cardiovascular protection.
Yeah. I don't know how old I was. I was in college, I believe. I went to a doctor in my hometown and I was like, I don't know what's going on with me, but I feel very flat. Like I'm not depressed, but I'm not getting the highs and lows like I normally do. And I'm just like kind of meh. And to this doctor's credit, rather than saying, it sounds like you might need like an SSRI or something to get you out of the doldrums, they said, I want to check your vitamin D levels. And I was incredibly low, like crazy low. And as soon as I started taking that supplement in a high dose, it was like zip, somebody turn the lights on again. And I'm so glad
Amazing.
that they went that way.
Absolutely
No idea.
amazing.
Yeah. So other than like the symptoms I've had that have improved, my energy's better. We talked about the weight not being so stubborn, warming up. Um, but I just initiated sex with my husband the other day. So one of the things, and I am gonna be so open about this because I think that this is something I talk about with women all the time. Like it is at my age when we have multiple kids in activities and you're already so busy and you're like ships passing in the night sometime, you and your spouse. Um, to add like a decreased libido on top of it is just kind of a recipe for disaster. And I mean, a healthy sex life is just so important
Oh,
for
yes.
and so that was important to me, and not because we weren't, that's always been great for us, and it was more just like it would not cross my mind if I didn't have a partner. Like, thank God for him, because he would initiate and everything would be great. But I was missing that part of myself that just like had the desire. And Yeah, that's back. I'm happy to report. Thank
I
you.
love it. So
I think you should
let's,
send you like a fruit basket or something.
yeah. So let's talk about the amazing hormone of testosterone.
Yeah.
So in women, 80% is produced through our ovaries, and the remaining is by our adrenal glands. We talk so much about testosterone for men, but it's critical for us women.
Mm,
Testosterone obviously helps with what you're describing is improving your libido and sexual health, but lean muscle mass, bone health going into menopause, bone density, collagen, wrinkles,
mm.
decreasing visceral fat. That's the bad fat inside that wraps our
Around the
organs
stomach.
in our abdominal cavity.
Mhm.
A reduction in triglyceride level, cardiovascular health, improvement in HDL markers. I track all of this with my patients, as you know.
Mhm. Mhm.
It's incredible.
Yeah. Yeah. I mean, other than like that botch study, I'm just trying to think of why is this like questioned and demonized hormone replacement therapy? Because literally everything has improved. And that's just and I know just from talking to you, like that's not just like for me, that's across the board with your patients.
So thank you. Now you can imagine my life as a provider when this was being taught. I didn't want to believe it, right? I didn't want to believe it.
Yeah.
I felt lied to.
Right.
I think, Lindsay, we also haven't touched on confirmation bias in
Mm,
medicine is so profound, meaning when we're taught something, it's ingrained and it takes so much for us to basically reprogram, right? Because so much we learned there's so much information out there, and it's unless your blinders are not on, unless you're open to learning, I think you're always going to be going down that path of what you were taught.
right.
It
Yeah.
takes so long, sorry, it takes so long for clinical practice to change. We're the research is there. It's
Hmm.
just now how are we getting it into practice? And do we want to get it into practice? That's another question.
Right, right. And I think you said something that I want to expand on too about the confirmation bias, because in my experience, sometimes the most educated people have the hardest time uh, being open to changing their mind to a different approach of really towards anything. Because it's almost like you you go on this path, and the more education you have toward that path, the more you're on this like narrow one lane road. Whereas if you don't have that specified education, you can get information from, this source, from this anecdotal thing, from I've heard this podcast. And so, yeah, I feel like it can be almost a catch 22. Like you have all this education, but now you're kind of pigeonholed into what you believe and are willing to accept.
And I think it also, when you're at times pigeonholed in your hands are tied when you're working for a large organization.
Mhm.
Um, I wouldn't be able to do what I do. Well, first of all, I wouldn't be able to spend an hour with my patients, as you know,
Right, right.
in a medical care model.
Yeah.
Um, yeah, I do think though that I think I think providers are waking up
Mhm.
and seeing what, you know, what we're doing is not necessarily helping our patients, getting our patients healthy. Why am I treating a patient in their early 20s with type 2 diabetes? how did this happen?
Right.
Like, that's the questions we have to start asking ourselves, right? And for your listeners, type 2 diabetes is, metabolic disorder generally coming from diet alone,
Mm-hmm.
the foods that we're eating, exercise, what are we doing for movement? How are we sleeping? How is our emotional health? All of these, you would think, primal areas that you would want to discuss with your physician, nurse practitioner, we're not afforded the time, typically.
Mm-hmm. Mm-hmm.
Um,
We obviously have talked about a lot of classic female symptoms, which, you know, perimenopause. I want to talk about kind of what you see as that range of perimenopause and then like age range, or does that even matter? And then what are the ages of people that you treat? So maybe let's first talk about age range of perimenopause.
sure. So the really the definition of perimenopause is anywhere between 2 to 12 years prior to your menses ceasing. So prior to menopause starting. So really it could be anywhere in that age bracket. Now I've had younger patients, but on average it's anywhere between 35 plus to menopause. I see women as young as 18. I treat adults only. So I see a lot of women and treat polycystic ovarian syndrome, which is an endocrine disorder. I'm very transparent with my patients. I'm diagnosed with PCOS, and why it's so important to never miss this diagnosis in clinical practice, which it's often missed because it really is a spectrum of a disorder. We're more at risk of breast cancers, ovarian cancer. We're 25% more at risk of insulin resistance and diabetes.
Mm.
And simple blood work along with patient symptoms can diagnose this. It's a clinical diagnosis. So I see women as young as 18. I have women in my practice well into their 80s that are thriving,
Amazing.
amazing. So I treat men as well, typically 40 plus, but I certainly treat younger men who have a diagnosis of hypogonadism, which is a clinical diagnosis of a low testosterone level on lab work.
Oh,
Um,
how
but a
common,
lot of, sorry,
how common is that?
not so common. I would say about 75% of my patients I'm treating for symptoms of andropause, which really is the medical term for male menopause. So
Oh, I didn't even know
symptoms,
there was a term for it.
yeah. So symptoms are, they're similar to menopausal symptoms, but unlike menopause, which is right, there's like a gradual decline for men,
Oh,
which their testosterone gradually declines, starting off at around 35. Um,
interesting.
and yeah, so their symptoms are similar. Sleeplessness, excuse me, sleep disturbances, low energy, lack of motivation, decreased libido, difficulty with erections, lack of concentration, brain fog, inability to lose weight.
Mm. Interesting. So, for instance, Gary turns 43 next month. He doesn't have any of those symptoms. So for somebody who is like working out a lot as he does that keep your testosterone level raised or?
Yep. So exercise does help, you know, increase your testosterone levels.
Okay.
For Gary, it would be interesting. Like I have a lot of men who I don't necessarily just prescribe testosterone for every man that walks in my clinic. I take a full, holistic uh, evaluation and approach. But it would be interesting to see Gary's vitamin levels, right?
Perfect.
And just a basic hormonal assessment to see where he's at, look at his thyroid.
Yep.
levels, and I have had such amazing outcomes with my men who are carrying excess weight, who we need to move. Their cardiovascular markers, their triglyceride levels are
Mhm.
through the roof. And the outcomes that I've seen with hormone optimization is just incredible.
Yeah. Yeah. I mean, men, I can imagine that they probably feel so much younger when their testosterone levels even out, just like the 20-year-old version of themselves.
Right. And I'm not treating to super physiological levels here. I'm treating to the
Right.
upper end of range of the normal range, right? Um, and it's incredible. One of the first symptoms that typically my men report is just an overall feeling of wellness. I just saw a patient yesterday, and it was his 12-week visit with me, follow-up visit, and he's like, Jen, he's like, I don't know how to describe this, but I'm just nicer. Like my mood is my mood is improved. And I'm like, that's great. That's awesome. Yeah.
Awesome. So there's kind of like this, I don't know. I guess I've talked to my mom and I talk about this, but as men get older, they t typically get more sensitive, you know? So is and like weepy, which I have seen in some men, not mine, but not my father, but I have seen that. And is that typically a direct result of the testosterone dipping down?
Yeah, it certainly could be. I mean, depression, that's a huge
Uh,
one, especially for or our, you know, older males above 65 years of age.
yeah, so these poor men who aren't getting their testosterone levels checked because they leave a career at like 65 and the only life that they've known for the last, you know, 40 years. And so they leave that, plus they have, this dip in testosterone. And unless they get that figured out, that's got to be really hard on men at that stage in their life.
Terrible from an emotional health standpoint to a physical health standpoint.
Mhm.
You know, men who have low levels of testosterone are more at risk of prostate cancer. Wait,
Wow.
what?
Wow.
It's it's unbelievable.
One of the things that I didn't even think to ask about before this, but as we're talking about it now, we have so many endocrine disruptors in our
Yes,
environment. Um, and so we see a lot of estrogen mimicking, things that we're, I don't even think we can like realistically get all of them out if we tried. I mean,
no.
I know I try to be as clean as I can, but even like some of the clothing that has forever chemicals, like my yoga pants, there's things like that. So do you think the average person is hormonally off?
Do I think the average person has a hormonal imbalance? I think that, like you just mentioned, there are so there's endocrine disruptors in our water, for gosh sakes.
Mhm.
Um, I think in our plastics, everything, our hair products, our deodorants. I think that it's definitely doing damage.
Yeah, yeah. I would, I mean, it would be fascinating to know like the average person's uh, hormone dysregulation as compared to say 50 years ago, because I think that
Exactly.
oh, a wild difference.
Exactly. And by the way, you just brought something to mind. Do you know that our ranges in medicine haven't changed for the last 50 years?
Wow.
Meaning our population is getting sicker, but we're still using the exact same ranges.
Dang.
That in itself is a problem.
And how is that range even created? And maybe you've touched on this before, but
Well, it's the average for a woman, for example, if we use you, an average woman of your age who is both sick and well. That's the range of
Okay,
that we
right.
use.
It was both sick and well, because that makes,
Correct. Or does that make sense?
oh, okay. Yeah.
That's the whole real premise of hormone optimization, right?
Yeah.
Do we want to be categorized with sick individuals, or do we want to help, optimize our hormones and um, prevent, be on the preventative standpoint, aggressive prevention,
Mhm.
tailoring treatments to what you need, not what the mass needs.
Yeah,
That's really where I think medicine is going.
me too. Me too. The more um people I connect with and see, like the way that we're all understanding just how important, and I mean, not just important, looking at the root cause is the only way. Otherwise, we're just dancing around the issue. We're using band-aids. We're, you know, we're treating a symptom without treating the root cause. And I think people are just over that. I think everyone's going to just demand a change. And it might be people leaving primary to seek, I myself, I don't see a primary for most things. I go to a chiropractor for preventative medicine. I see you for to regulate all my lab results. I'll go get a mammogram or my
Mhm.
female check. But yeah, that's, you know, unless something crops up, that's pretty much it. So I think it's using kind of a team of people who are approaching the body in a very holistic way. That's
Right.
where things are going, which is so cool.
Absolutely.
Rather
And
than have all the answers,
say it again.
rather than one person to have all the
Ri-
answers.
Well, that's just it. Why is it wrong to say, I don't know. I don't know the answer. Let me go to the literature and research and see what it says. I have a great patient story about this.
Yeah.
Um, I have a patient that in her late 30s, very similar symptoms to yours, decreased libido, um, inability to lose weight. She had cold hands and feet as long as she could remember. Um, what else did she tell me? Oh, she was having trouble sleeping, night sweats. PMS was at an all-time high. Um, she went to her primary care provider on 3 different occasions, and she was told her lab work is normal. Um, Basically, it's a normal part of aging, and move more and eat less, right? So she comes to me, we start working together, and I just had it was about 7-ish week follow-up. I'm I have her on a nutritional plan, lifestyle plan, optimizing her hormones. She's lost 20 pounds
In 7 weeks.
in 7 weeks.
Oh my gosh.
Her PMS symptoms have literally resolved. She tells me her cold hands that she's been experiencing like her entire life are gone. Her PMS, her energy levels, everything is improved. So she happened to have a PCP visit, like a wellness annual check, a week prior to my follow-up with her.
Mm.
And she's recounting this over the telephone, and you could see, uh, I know where this is going. So she's like, so she walked into the room, and her PCP, she says she was elated with like how I looked, and she had gone 3 times, right, for help.
Yeah.
Elated how she looked, and what are you doing? Um, and she began to tell her that she is on a lifestyle nutritional plan and she feels less inflamed, and Um, her hormones are being optimized. She tells me her PCP immediately dismissed her, told her that it's unsafe what she's doing, and um, said, well, you can continue doing this, but I don't recommend it. So, and I said to her, what did you say to her about that? And she said, well, I did what you said in the sense that I went to the literature and researched myself. And she started countering her what
Amazing.
she was saying.
Amazing.
And this comes back to that, if that was me years ago before I started training in bioidentical hormones, I wouldn't, I would have questioned my patient, but I wouldn't have dismissed her
Hmm.
because you go into nursing and medicine to heal people, right?
Yeah.
You would think.
Right.
And I just think that this misunderstanding and um, it's this fear that is not there. It's unfounded.
That's what I was just going to say. Unfounded. Yes. Like,
So anyhow, so that was a story that I just encountered, and but I think it's telling. And again, it's not coming down on this particular provider, but it's sad that if you don't know, then say, I don't, you know what? I don't know. It looks like it's working for you.
mhm.
Perhaps I should go and look at the literature surrounding what you're doing.
Right. And unless you were prescribing just like a synthetic pharmaceutical pill that, was magically doing things
Mhm.
that, of course, we know would have bad adverse effects and whatever, um, wouldn't she have more curiosity as to like how like this is fascinating? I mean, I don't know. I mean, maybe I'm just more of a curious person, but I do
I
think,
think, yeah, no, exactly. And I think that comes to, that's more of an individual. And I think that's just, in my opinion, ignorance.
right.
Um, because I'm same as you. I'm curious, like, wow.
Yeah.
And I didn't even mention her biomarker change. I mean, that's what's just unbelievable. So we have a marker called a CRP, a C-reactive protein. It's an inflammatory marker in our body. It was sky high. It's now within normal range. In 7 weeks, she's never had a normal CRP level. She told me.
You're kidding.
No.
Wow. And what would have normally been the course? I mean, what had they tried with her primary? You said she didn't, they just basically said your labs are normal, go eat less and exercise.
Yes.
That's so condescending, first of all.
Isn't it?
I would,
Yeah, I said to her, I think you need to find a new primary.
yeah, yeah.
Um,
Uh-huh.
I
Yeah,
mean, we didn't even get into the whole nutritional that's your sister's, I think, your sister's specialty, but um that's a whole other that's a whole other beast.
you're right. Well, I remember you looking at like my macros. I mean,
Right,
and you were like, "Oh yeah, I would keep you at that." So
right,
I knew
right,
it wasn't, I knew it wasn't my macro ratio and my nutrition was dialed in.
right,
It was the thyroid and the hormones.
right. But you know that I didn't learn an ounce of nutrition throughout my education.
Oh, right. Oh, I'm well aware.
I had to go and suss that out myself.
Yeah, I follow,
I had no idea what a macronutrient was.
right. I follow Casey Means very closely, doctor,
Oh, sure, yes.
who is a Stanford graduate of medical school, medical doctor, and she did not have one nutrition course in
No
all
kidding.
of medical school. And so Chris and I just talked about this in the podcast last week, and but it speaks to how uneducated, as intelligent and educated medical doctors are, how uneducated they are about nutrition, which metabolic dysfunction is the catalyst to the vast majority of diseases we have today.
You would think that that would be at the forefront of our education.
Right.
And again, this speaks to back to my primary care days. I was finding myself talking about what are you eating? What are you doing? How is your sleep? I tell my patients, if your doctor or provider doesn't ask you about your sleep quality, your emotional health, your movement and exercise, and your nutrition, and now of course I talk about hormones, but I don't expect them to, you need to find a new provider.
Mm, yeah.
Instead of just writing you that next prescription.
Yeah. Yeah. And there are absolutely doctors who do that. And then there are ones that don't. So I think you're so right. It's so important to find a doctor that looks at all of those very basic but so critical pieces of our makeup. When you started asking those questions, was that just because you led a healthy lifestyle and were starting to, say like, well, I wonder if these people are sleeping, or I wonder what they're eating.
I think that my my career started off in nursing, and I think that was the foundation of my approach from a holistic standpoint. And throughout my career in medicine in outpatient primary care, that was always a staple of, and my patients know this, that it was always a part of my wellness exam. Um, so I think that was from my nursing background.
Okay. And is that common with nursing?
I think from a nursing perspective, I think the holistic standpoint, you know, is, I would say.
Yeah. Yeah. Okay.
Yeah.
Yeah. That's good. I have a few nurse friends, and I just know that they lead a very
Hmm.
holistic lifestyle.
Yeah. And then of course, to what you said is I've always, I've been an athlete since I've been a young girl. I played hockey and soccer, club soccer in Montreal, Quebec. And um, I lead a healthy lifestyle. I'm active.
Mhm.
My family is. So I think it was just ingrained in me.
Yeah.
Um,
I forgot you played hockey. What position did you play?
yeah, I played left defense.
Oh,
I was actually on the first women's team in Beaconsfield, Quebec, in Montreal.
that's awesome.
Yeah, and my dad coached me. We started the women's hockey team in my high school at Royal West Academy.
That's so crazy. I was on the first varsity hockey team in Grand Rapids, Minnesota.
I did not know that. How awesome, Linz. What position did you play?
I was goalie.
Oh my gosh. We got to get on the ice.
Yeah, well, I'm a bit of a sieve, but I'll totally do it. I love it. So it all started, I mean, everybody in Grand Rapids kind of played pond hockey growing up,
Yeah.
just like with you. And so, but I remember we had a sixth grade floor hockey tournament, and for whatever reason, I was a goalie, and we won that tournament. It was like cred. And so I was like, oh, maybe I'm kind of good at this. And then I used to flip the fireplace like covering at my parents' house. Like you turned it around and it
Yep.
looked like a net. So I used to be in front of that, and I would make my parents or whoever like I had a rolled up masking tape ball, and then I would use a dustpan to like stop it. So yeah, that was kind of like what I did, I don't know, and like when I was younger. And then a team was forming, and we had a really good goalie that played with the boys. And so she was going to be the starting goalie, but they needed a backup. And she was a year ahead of me. So I was like, well, maybe by my senior year I can play. So yeah, it was super fun
Awesome.
through high school. Yeah.
Oh, I love it. So, and your kids play sports as well.
Yes, Garrison plays hockey, football and baseball, and Whitney dances year round.
Yeah.
Yeah.
We're hockey, 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 soccer. Crazy.
Yeah, busy,
So busy.
but so fun. And yeah, I mean, to circle back to, so many listeners are at this age where we're in the thick of it. Our careers are busy, busiest they've ever been. Our kids are busier than they've ever been. And so if you're feeling bogged down, like physically already, it just, yeah, I mean, I want to encourage people and let them know they don't have to feel that way. Like they can optimize their energy, their all the things. I can't recommend this more highly. It's a game
Thank
changer.
you. I think just to start, um, is just get your blood work
Yeah.
checked. That's a start. Um, look at your biomarkers and go ahead.
I was gonna say, so I think the issue is a lot of people will get their blood work done, and they'll take it to their primary, and their primary will be like,
Right.
"Oh, your blood work's fine," when you would analyze it much differently. So, what do you say to that?
So I would say I recommend finding a either functional medicine provider, in your area that will look at it, your symptoms, will actually treat your symptoms, and get them into a functional range. Or look out for a BHRT provider. You can actually go on the website of where I was trained, the Academy of Preventive and Integrative Medicine, and search in your region for a BHRT prescriber that's certified through WorldLink.
Mm,
So that would also be an avenue. Because unless your primary is versed in hormone therapy, I don't expect them to understand.
hmm hmm Yeah, I think a lot of people are probably curious about how that works. Does it work with insurance, things like that? Um, and before you answer, I just would like to say, as with anything, I think you can either invest in your overall health and well-being and your preventative health, or you
Yes.
can invest in the problems that are going to crop up down the road. So I'm all about, gym membership, chiropractic, optimizing my hormones, my thyroid with you, doing those things so that I'm not paying hospital bills down the road.
Spot on, Lindsay. So typically functional medicine and BHRT is not covered by medical insurances. As I said, bioidentical hormones can never be patented, so
Mhm.
they can never be prescribed typically to your local pharmacy. They're prescribed to a compounding pharmacy. So I prescribe to MedQuest. I prescribe to one that's out of Utah, and they're fabulous. Um, but yes, and that question comes up, sometimes with my patients, of course, but for the majority, exactly what you said. It's about it. What is it? An ounce of prevention is a pound of cure.
Yeah, exactly.
So I and I love how you said, like your membership at the gym and or your chiropractor, same similar.
hmm hmm Yeah. Yeah, I think I grew up thinking you go seek wellness when you're sick. You go to the doctor when you're sick. Um, and it took a while to break that like thought process and realize no, that wellness is about prevention, and it's about feeling good and optimizing your health as opposed to just waiting until things go awry and then you go seek help. Our system's set up this way, but as we were talking about before, I think it's changing, and I'm super hopeful of that.
As am I. And I see it when I start getting referrals from specialists.
Amazing.
That's the best, right?
Yeah.
So cardiologist, other primary care, and in primary care, I've talked a lot about this, but we don't have the luxury from the structure in place
Yeah.
to spend the time that we need with patients. So
Mhm.
I can tell you that, another reason why I decided I ended up going towards this route, I still remember this one woman, and if you're listening out there, I can help you now. There was this one woman that was going through menopause, and this was when I worked in outpatient primary care,
Mhm.
and she came to me with all of the symptoms that we've mentioned. And I basically said, it's a part of getting older.
Ah,
And
mhm.
it still haunts me. Um, so just my train of thought there, but it's just we're not afforded the time, and we also we unless you seek out additional training, you don't know.
Right, right,
So in that sense, I do remember saying to her, I don't know what to do. I don't, you know, your lab work is normal.
right. Well, maybe she's on some podcast
I know. I
sharing
know.
her story. Yeah. Well, I'm glad you shared that example because it shows that like that's the norm, and that's the frame of mind you're operating from until you seek out really more information. I mean, that's
So exactly. And that you just triggered me to remember what I was going to say too, is that when I'm getting referrals from these primary care providers, they're pleading for help, right? They're like, help me because I don't know what to do with these women.
yeah, yeah. And you're licensed to work in it's Minnesota and Rhode Island. Yeah.
And Massachusetts. Yeah,
Okay.
so I hold three licensures.
Awesome.
And then, as you know, I see my Minnesota patients annually, hopefully twice a year,
Yeah.
going up in person, that is. Otherwise, I offer telemedicine services.
Okay.
Um, but definitely once a year we see each other.
Yeah. Which is fun. When's the
Yeah.
next time you come in the spring?
Um, I'm gonna shoot probably I loved coming in August.
Yeah.
That was such a great visit.
Yeah.
Um, but maybe the spring. Otherwise, I'd probably stay the course with August.
Great time of year to come. Yeah.
Yes, yeah, I had a great time. And
Yeah.
it was so great to see my patients, in person. It's a great visit.
Yeah. Oh, I mean, you've covered so much. I would love to direct people to like where they could connect with you. I know you're on Instagram.
Mhm.
Um, of course, this is always in the show notes. Sometimes yeah, I like to shout it out too. So
Yeah, so many different avenues how to reach me. So, like you said, Lindsay, I'm on Instagram at Renewed Health LLC is my handle. And then my website is my-renewedhealth.com. And you could either schedule your appointment online at a time that's convenient for you. You can see what my openings are. Alternatively, you can call the clinic here and speak to my patient care coordinator. Her name is Alice, so she'd be happy to schedule you an appointment. Um, but to get the ball rolling, it would be an initial phone consultation, and it's an hour long. We didn't really touch upon the process of it, but
Yeah.
I
Speak
don't
to
know if you want to. Yeah. So the initial consultation is 1 hour, and I review your medical history in detail, review your symptoms that you're experiencing, and then typically I end with, what are your health goals, um, and the next steps. And can you imagine, what are your health goals being asked, right? So many of my patients are like, what do you mean by what are my health goals? I'm like, well, where do you want to be? Where do you want to be in 5 years, in 10 years?
Mhm.
Um, and then following that, I send my patients for comprehensive lab work, which looks at a hormonal panel, a metabolic panel, and advanced cardiovascular assessment. And for my Minnesota patients, well, for actually all my patients, I use Rupa Health. It's a functional medicine lab company. So it doesn't matter where you are in the state, you can have your labs drawn, like It's pretty simple process, isn't
Yeah,
it?
very.
Yeah. And then following that, you get to spend another hour with me, and it's the treatment visit. So for my patients that are coming to my brick and mortar clinic here, it's in person, and then alternatively, it's telemedicine, a virtual visit. Um, and then we get the ball rolling. That in that visit, I review your lab work in detail, and then I would have already devised a um, treatment plan that's targeted for individualized to you.
Yeah. And that meeting with you, when you go over the results, it's like it's so affirming to just feel like, okay, I'm not crazy. Like, thank you for showing me that, like, yes, all of these things are very valid.
Yeah, it's a very I acknowledge, first of all, I wish I had like 2 hours to spend with my patients, because even the 1 hour together is just doesn't even scratch the surface. Um, but I also acknowledge, having done this so many times, that it could also be very overwhelming for patients, in the sense that, they've never received this information before. Um, I in clinic, I sit down with my patients next to them. I review the lab work together. It's
Mhm.
more of an informal conversation, rather than, across a desk, or I'm just staring at my computer and typing
Right,
for 10, 15 minutes.
right.
Um, and again, not coming down on anybody, but that's the structure that we live in. Is It's in and out, and you're more focused on getting the computer aspect of it than the actual patient.
Yeah.
Um,
We can be supportive of individuals and professionals and still question the structure and policies that are in place.
yes,
Can I say that a million times over?
yes. You can clearly see I'm having a hard time.
I know, but that's the thing we all
I
get.
don't want to offend anybody by
Yeah.
saying that.
Eh,
Yeah.
I'm a former teacher and I've questioned a lot of things in education and have been vocal about it. And um, it's interesting how there are teachers that kind of feel like slighted by it. It's like, listen, this isn't personal. This is a
Well,
systematic
it's a
thing that
system
I'm
issue,
questioning.
right? Absolutely.
They're phenomenal humans, and I can question the policies. So, yeah.
You got it.
Mhm. Yeah. I am beyond excited to share this with people. And for people listening, if they have more questions about my personal journey, I'm so happy to just share. I'm an open book. And yeah, I just want women to know that like they're not crazy. If they're going through things at this stage in life, there's help to be had. And men. And yeah. If I ever see those symptoms, now that you've listed all of them of testosterone dipping with Gary, you better believe
Yeah,
writing them in, like
right.
a masculine man
Yeah,
to stay intact.
absolutely. And I'll just add, to what you said, is don't have to live like that. You don't have to experience the night sweats for the next 10 years, you can get a good quality night's sleep and wake up feeling refreshed. What?
Right.
Like ready to go for your day. You can have energy that lasts throughout the day. You can work a full day and then come home and play with your kids.
Mm.
It's just like those little things. Um, and it doesn't happen overnight, of course, like anything. But slowly, as you say, we had, and in my own personal experience, you see symptom improvement.
Hmm. Yeah. And it can happen. I mean, pretty remarkably quickly too, depending upon each person. So yeah,
Right.
yeah, so cool. I can't thank you enough for spending time with me today. I know we've already ran over the time, but like this was so important, and I'm so grateful to you for what you're doing, and I can't wait for people to tune in.
Thank you, Lindsay, and thank you for what you do. You're a trailblazer.
Thank you.
It's unbelievable. And I'm privileged to treat you.
Mm. Well, thank you so much. This has been awesome. And I will, yeah, I'm looking forward to staying connected and continuing to do the work.
Awesome.